The simplest of things can have the most profound effect. This is undoubtedly true when it comes to preventing infection and contamination, both in healthcare facilities and in the wider world. The simple thing in question is hand hygiene. It takes only 15 seconds, but is perhaps the most effective measure in the battle against avoidable illness among staff, patients, and the general public. The Scottish National Hand Hygiene Campaign covers the whole of Scotland, a population of between 5.1 and 5.2 million, spanning the densely populated urban areas of the Central Belt out to the rural areas of the Highlands and Islands, which have a much lower population density. This is a totally inclusive nationwide approach, which involves a collaborative effort from each of the 14 territorial health boards covering Scotland, as well as 3 special health boards who are all using the same materials and auditing tools but are part of a single overall campaign. It's the first time such a joined-up approach has been employed across an entire country. The post of Local Health Board Coordinator for Hand Hygiene has been introduced into all health boards across Scotland. These coordinators are tasked with raising awareness of the importance of hand hygiene and auditing hand hygiene compliance against the World Health Organization's 5 moments. The role also involves training staff and distribution of campaign materials. Nowhere else in the world have such dedicated posts been created to implement a campaign of this type across a whole country. Scotland is the first.
I think for me one of the best things about the campaign here in Scotland is the fact that it's been a national campaign and everybody in the country is obliged to do it, and I think that's been a wonderful thing. To be the only ones in the world doing that, I think we should be really proud of ourselves.
Central to the campaign is raising staff awareness of the 5 moments for hand hygiene. These are before touching a patient, before undertaking a clean or aseptic procedure, after body fluid exposure risk, after touching a patient, and after touching patient surroundings.
Moment number 1, before patient contact, and moment number 5, after contact with patient surroundings. That was really the 2 main areas that caused most problems in our health board, and they were addressed with adding another moment into our own local tool, our own local audit tool, which was before applying gloves, because it was actually before applying gloves that was a problem. It wasn't before patient contact, it was specifically the glove usage, and that was really effective.
We definitely found in Glasgow that the audits revealed that number 5, after contact patient surroundings, was less frequently complied with. And there was a lot of discussion around why that would be, and it seemed to come back that people weren't aware of the risks, maybe with environment contact rather than patient contact itself.
In Grampian we've certainly struggled around moment number 1, which is the before patient contact. A lot of our staff are choosing not to perform hand hygiene and just directly going for aprons and gloves. How we've got around that is just through a lot of training and education, and that's actually explanation of what hand hygiene and all the different key moments are.
Another important aspect of the campaign is making staff and members of the wider public familiar with the correct usage of alcohol-based hand rub, both how to apply it correctly and when it is safe to use instead of soap and water.
Whilst the gel in normal circumstances is 99% effective, we found a lot of staff weren't aware of the circumstances when it wasn't appropriate to use it. So the 2 posters helped to reinforce that advice, along with the education sessions we run on a weekly basis.
We did similar to what you did, Steph, but we also supplemented it with using the in-house magazine. We've got an article in there, quite a large article.
When staff have been using alcohol gel within our areas, they've had problems picking up the fact that their hands are actually physically soiled, so we've had to do one-to-one training with them.
With local health board coordinators for hand hygiene situated in every health board, it means that they are able to effectively work with staff to ensure the uptake of the campaign's initiatives. Staff training is an ongoing process and is designed to instill a culture of hand hygiene throughout all the different disciplines of healthcare staff at every level throughout the National Health Service in Scotland.
We've been using various methods in Highland with regard to training of hand hygiene, and we've found the light box a really useful tool. From something that I suppose is a simple idea, it's actually one of the best methods of getting across to people.
I just use an agar plate. There's sometimes a bit of a reluctance because obviously they know it's going to come back with results, For people who are resistant to the concept, it's a great, turnaround tool.
One member of staff was allocated the badge to wear to prompt fellow members of staff or visitors or medical staff when they should have taken the opportunity to decontaminate their hands.
I looked at audible message units and we trialled them and found that the use of our hand rubs went up 200%.
To raise awareness of the need for hand hygiene, a national public marketing campaign has run since 2007, using platforms such as TV, online and radio. Research showed that 80% of the general public are now more likely to wash their hands more often as a result of having seen the adverts, and 88% said that the campaign had made them more aware of the importance of hand hygiene in preventing the spread of infection.
The website has been quite useful in terms of being able to download materials and sharing with other organisations or other staff groups that particularly want to access things. I've certainly found it useful.
I think it definitely made it more personal for staff when you gave them a credit card size reminder, because it was something they could use themselves.
Yeah.
And also it reminded them that there was posters on the walls and there was leaflets reinforcing the message, but at the same time they had something they carried about with them. And I think if we're trying to change people's behaviour, you'd have to make it personal for them. You have to make sure they're involved.
Recently in NHS Orkney we have just introduced the lighted signage, which actually flashes at you as soon as you enter the department. Just as a gentle reminder, to wash your hands, and that seems to have increased the awareness.
When the posters came out at first with the WHO moments on it, the 5 moments, we only had the patient in a bed in an acute setting, whereas now they've given us extra posters and the patients in different environments, at a chair, be it in a GP surgery, on a wheelchair, being transferred in a trolley, and you can now use them out in primary care environments, so that no matter where the patient is, the moments never change.
And certainly for the 3 to 6-year-old, the feedback I'm getting is they really respond well to it, particularly the animation, which all kids love a cartoon, but it really seems to work with them.
It's just a really good resource because it's obviously aimed at the children, and it's for that age, and they love all the handy in the video, and and they just respond to it. And if we could just get such good feedback from everybody else as well, if we could have an adult children's pack, it would be wonderful,
The local health board coordinators for hand hygiene have been equipped with a tailor-made software system loaded onto tablet PCs specifically designed to audit hand hygiene compliance. The data are collected from all relevant health boards and reported nationally to give a snapshot of how the campaign is impacting on hand hygiene compliance throughout NHS Scotland. The audit process benefits frontline staff too, in that local health board coordinators for hand hygiene can provide reports to clinical teams immediately following audits in real time that allow them to see how they are performing and to quickly devise and deliver action plans where staff need more support to improve their hand hygiene practice.
As an infection control nurse, I wondered about how this compliance tool, which is entered onto the tablet computer, would work. I've been used to doing audits and environmental audits with paper tools and then analysing them. I think this is the most powerful tool that I've worked with in 25 years.
The results point to just how effective this campaign has been. Over the 7 audit periods, recorded overall average compliance figures have risen from 68% to 93%. Figures show that NHS Scotland exceeded the target of at least 90% compliance. This target has now been superseded by the Cabinet Secretary for Health and Wellbeing's announcement that all health boards must adopt a zero-tolerance approach towards non-compliance with hand hygiene. So as the campaign continues, the message remains the same.
But I've seen the progress that the ambulance service has made, and from reading the reports I can see the progress that everybody else has made, so we really are on a high and we're really pushing this.
We've seen a huge difference in our local hospital, and medical staff, nursing staff across the whole board, they've all taken it on board and made a vast difference to their work.
Germs. Wash your hands of them.